Hi, I'm Cathy with Level Up RN. In this episode of Ask a Nurse, I'll be answering your questions about benign prostatic hyperplasia, or BPH. We'll cover what BPH is, its symptoms, and how it's diagnosed and treated. Benign prostatic hyperplasia, or BPH, is a condition in males where the prostate gland is enlarged. Benign means not cancerous, and hyperplasia means too much growth. So BPH is an enlarged prostate, but not due to cancer. The prostate gland sits under the bladder and surrounds the urethra. Its main purpose is to support fertility by making a fluid that goes into the semen. As a man gets older, hormone changes, including a decrease in testosterone, lead to enlargement of the prostate. When the prostate gland becomes enlarged, it can push against the bladder and the urethra, causing issues with urination. BPH is extremely common in men over the age of 50. In fact, 50% of men between 51 and 60 have BPH, and 90% of men over 80 have it. Other risk factors include a family history of BPH, obesity, heart disease, type 2 diabetes, erectile dysfunction, and a lack of physical activity. Signs and symptoms of BPH include frequent urination, including at night, urinary urgency, and incontinence. BPH can also make it difficult to start urinating, cause a weak urine stream, and result in dribbling after urination. Other symptoms include pain with ejaculation or urination, a change in urine color or smell, and urinary retention. Urinary retention, where the bladder doesn't empty completely, can in turn cause urinary tract infections. To diagnose BPH, your provider will obtain information about your medical history, symptoms, and family history. They may also perform a digital rectal exam, where a gloved finger is inserted into the rectum to feel if the prostate gland is enlarged or tender. Other tests include a urinalysis, a PSA blood test, and urodynamic testing to assess urine holding and release. A cystoscopy allows the provider to look inside the urethra and bladder, while a transrectal ultrasound uses sound waves to create images of the prostate. Finally, a prostate biopsy may be performed to rule out prostate cancer. Treatment of BPH includes lifestyle changes, medications, minimally invasive procedures, and surgery. For mild symptoms, lifestyle changes like drinking less fluids before bedtime, cutting back on caffeine and alcohol, and engaging in bladder training can help. Pelvic floor exercises can also help decrease urine leakage. Common medications include tamsulosin, tadalafil, and finasteride. Tamsulosin, brand-named Flomax, relaxes prostate muscles to improve urine flow. Tadalafil, or Cialis, commonly for erectile dysfunction, can also relax lower urinary tract muscles, improving urinary symptoms. Finasteride, brand-named Proscar, helps prevent further prostate growth and can even shrink its size. If medications are not effective, several minimally invasive procedures can treat moderate to severe BPH. These procedures either destroy enlarged prostate tissue or widen the urethra to improve urine flow. If severe symptoms persist, your provider may recommend surgery. The most common surgery is transurethral resection of the prostate, or TURP surgery. During TURP, a resectoscope is inserted into the urethra and enlarged prostate tissue is removed with a wire loop. This surgery typically takes 1 to 2 hours and often requires a 1 to 3 day hospital stay. That's it for this episode of Ask a Nurse. I hope it was helpful. If so, be sure to hit that like button. And if you haven't done so already, be sure to subscribe to our channel. Stay informed and stay well.